Did you know that children are watching pornography as young as age 10? Well, I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about, is pornography good or bad for children, and how should you talk to them about it? If you're new here, make sure you subscribe to the channel if you like what you see, and share it with your friends. Children will sometimes watch pornography to really satisfy their curiosities or to learn about their bodies because, let's face it, sexual education around the world is limited. In the first part of this video, I'm going to talk about how pornography affects young brains and if it really is a problem. And lastly, how you should discuss pornography with your children. Is this really a problem? Well, let's start off on how pornography can affect the developing brain, particularly in adolescence. There's 5 major components to this which can affect how brains process pornography in young children. Number 1 is the prefrontal cortex. This is the part of the brain that's responsible for making decisions, setting goals, making plans, and other sorts of very important things. And in adolescence, this part of the brain is still very immature. And so they may have a hard time deciding that watching this is actually not good for them or maybe causing other types of harm to the rest of their life. Number 2 is that children have something called neuroplasticity, and it's basically how our brains change in response to certain things and behaviors that we do. And it's really important for things like normal brain development and regulating yourself. For example, knowing that you have to be quiet in certain areas like the library. And so if they're affected by watching pornography, they may then develop circuits in their brain which favor the outcome of watching pornography, which leads us to part 3, which is dopamine. So if you watched my first video on pornography pros and cons, you'll see that watching pornography actually often leads to a release of dopamine in the brain. And that can lead to developing neural pathways that favor that dopamine release, meaning that your brain will want more and more of that dopamine, so it will continue to repeat that behavior. In adolescence, that dopamine system that produces dopamine is overactive, or it's in overdrive, meaning that they are more susceptible to things that give them dopamine. Hence why kids are always playing video games, or at least my kids are. Watching pornography can also activate another part of the brain called the hypothalamic pituitary axis. And when this is activated, it produces hormones like testosterone and cortisol. And when young children, particularly boys, are undergoing adolescence, their testosterone is already at a higher level. But higher levels of testosterone and cortisol can create a fight or flight sort of response and cause more emotionality and less ability to control their emotions and their behaviors. And lastly, this chronic exposure to cortisol makes your brain feel like it's in a chronic stressed state. And particularly in adolescence, this can affect, again, that neuroplasticity we spoke about and can cause children to have difficulty dealing with stress even into adulthood. And lastly, pornography can also impact the way children perceive their own bodies. As I talked about in my last video, you're seeing people who are professional actors who have, penile lengths that are larger or breasts that are larger than the average person, and it may make you have some insecurities. And there's not a lot of data on children and their exposure to pornography and how that affects them, because you can't put children in a study where they are either exposed to pornography or not. So the closest studies that we have are in young men. And the largest of these studies is one that was done in Belgium and Denmark, where they surveyed 3,500 young men between the ages of 18 and 35 who were recruited via social media or posters. They then asked them about their frequency of pornography use and then tested them with certain validated questionnaires to test their erectile function, and they used a specific questionnaire about cyber porn addiction. And they found that a lot of these men watched quite a bit of pornography, up to 70 minutes a week, and it was really variable. Some people watched it on average for about 5 to 15 minutes at a time. However, the average length of a porn session was about 5 minutes and 30 seconds, and only 11% of the sample watched more than 30 minutes at a time. And what they found was that viewing more pornography was associated with finding less satisfaction with sex with their own partner. In fact, only 65% of people found sex with a partner more stimulating than pornography. That means 35% are feeling that sex with a partner is not as satisfying as watching porn. Interestingly, the length of time that one watches pornography was not not indicative of their addiction score. But they did find that those who had a higher addiction score, about 21% of them had issues with erectile function in the last 4 weeks. 21% of young men having issues with erections is not normal. But again, watching more pornography was not necessarily indicative of addiction. So I think ultimately it's really important to realize if pornography is becoming a problem. And I talk a little bit about this in the video looking at the pros and cons of pornography, so make sure you check that out. But if you're noticing that your children may have problems with pornography, it's important to get them to talk to them about it. So how do we talk to children about pornography? I mean, should you be trying to limit them? Well, quite honestly, pornography is everywhere. And whether they let you know they're seeing it or not, they're probably gonna get exposed to it. So the most important thing you can do as a parent is have an open, honest discussion with your child. Start off by choosing a time which is really not a stressful moment. So maybe driving in a car or a place where they're not rushing off to do something or you don't have anywhere to be. You want to start with open-ended questions like, hey, what do you think about pornography? Not, do you watch pornography? Because that's a yes or no question and that may shut them down. Make sure they're aware that this is a no judgment zone. Make sure they feel that you're not going to judge them for their response and let them know that you're not asking because you want to shame them for what they do. You just want to know. Start by normalizing their feelings of arousal when watching pornography. For some people, some children, this can be very distressing when they don't really understand what's going on or they don't have the context of what's happening. Very important to stress the difference between real sex and pornography, meaning that pornography is a highly produced product. These are actors that are enhanced with special effects. There are special lighting, and these are, again, hired professionals. There is no sense of privacy in pornography when in a real relationship, obviously, privacy is very important. Also, there's very little discussion of consent in pornography. So you also need to let them know that discussing consent with their partner before going ahead with having intercourse is an important part of a relationship. It's also important to let them know that the responses of these actors and actresses are not normally what's seen during a sexual encounter. People are not necessarily having intercourse that lasts for a very, very long time, and they're certainly not having orgasms as quickly as it's shown on pornography. Also within the discussion, you want to talk about bodily autonomy, that you should never touch anyone without their consent or no one should touch them without their consent. And it's also important to let them know not to send nude photographs of themselves to their friends. And lastly, you want to talk about safe sex. The discussion they're having in school is usually not adequate enough for them to really understand everything they need to know about safe sex. And lastly, realize that this conversation is going to take some time. It's not going to be a one and done conversation. You're probably going to need to have a conversation over several days, weeks, months to really get in all of this discussion in a way that's not overwhelming to them. Okay, I hope you guys found this helpful. As always, remember to take care of yourself because you're worth it.